My name is Captain Brian Nanavaty, and I'm here representing the Dolan Consulting Group with hopes of providing you with some information or some peace of mind during this unique situation we all find ourselves in. So today we're offering you a video with some information and to relate to you on some things you might be able to do during this particular unique period that we discussed. We've entitled it Officer Survival in a Pandemic World, and it's really something that we feel very strongly about. I know the Dolans feel very strongly about it. The chief asked me if I would come up with something aimed at our law enforcement heroes during this particular period of time where we find ourselves with a lot of questions and not a whole lot of answers. So if you're not familiar with who I'm Captain Brian Nanavaty. I retired from the Indianapolis Metro Police Department back in 2017. And since that time, I've been on the road with the Dolan Group teaching a number of classes related to personal and career survival and frontline supervision. And I also teach for the Department of Justice and serve on a number of national committees with the FOP. I presented just about every conference on law enforcement, wellness, and development issues. And with that being said, I'm not going to spend a lot of time dwelling on my resume. If you want to read that, that's fine. But really, we're here for you. We're here to provide you with information. I'm sure you're aware, as most of us are, of what's going on in the world, and especially here in the United States with the COVID-19 pandemic. We've got over 600,000 reported cases of people being affected by this unique strain of virus, with over 27,000 deaths. And that information was as of yesterday, so it's been updated. You should see your state represented on this particular graph, and it will give you an idea of just what you're facing. But I think being on the front lines, you already know what you're facing. But there's again, some strange things going on in our profession. We have officers that have passed away due to being affected by the virus. Please, if you have the opportunity, go to the Officer Down Memorial page and honor those officers, our brothers and sisters who have lost their lives making the unique sacrifice. And the unique thing about this particular page is these are officers who their deaths have been attributed to COVID-19. And that's the unfortunate part of this, is that it's going to take quite a bit of work on behalf of your agencies and associated sources to be able to verify that that's the reason that our officers passed. And we're not going to get into why that is important, but I think we need to know exactly what we're facing in this profession as we come to work and attempt to do what it is that we do on behalf of the public safety. So please be aware of that, visit that page, and take a moment to honor those individuals, including an officer from my agency, Officer Leith, who passed away under her watch on April 9th, responding to a domestic disturbance. And this is really what we're up against in our profession. There are a lot of things going on at this particular time that some of them we faced, but some of them we've not faced. Some of them we're facing in greater numbers. If you look at the bottom of this particular slide, you see the Officer Lee's funeral and just what we're up against, and even trying to honor the passing of one of our heroes, social distancing during the funeral procession, not being able to visit. And this is very similar to what's going on in our households. If you have a member who's sick, if you have a member, God forbid, who passed away. Again, these are, I'm going to use the word unique probably 100 times before we're done here today, but these are unique times, and we're kind of making up the rules as we go along, which is unfortunate, but it also explains why we're not getting a lot of answers from the government, from leadership, from leaders of your agency, because it is something new to them. So before we go any further, I would like to take a moment and honor the Officer Leith and the officers that we highlighted on the Officer Down Memorial page, and officers in your own agency who have made the ultimate sacrifice, but also to take a moment and take a deep breath and honor those first responders who are on the front lines doing what we do, making that sacrifice without asking for any special attention or any anything special. So let's take a moment and honor those who have blazed the trail for us. Thank you for doing that. So what is it we faced during the course of our career? I started my policing career in 1984, and we've seen some things occur in the 1990s and the 2000s that we've never really faced before. There were always active shooters going back to the Texas Tower shooting and similar shootings, but it wasn't something that was as prevalent as it is today. Targeting of police officers and police stations, the New York case, acts of terrorism, 9/11, of course. I mean, these are things that we've had to get used to during the course of our policing career. Tuberculosis, very early in my career, I had to report to the hospital. I encountered an individual who tested positive for TB. And at that time, the testing procedures are very similar to what they are now, where you might get results a week later or 2 weeks later, and you never really feel comfortable in what you're hearing. You ask a lot of questions on, okay, what am I supposed to do about that? And not really given a lot of direction. What about doing prisoner searches or pat downs and being subject to infection through dirty needles and things we do going into people's homes where there's cockroaches and fleas and ticks and things like Lyme disease, which we were susceptible to. How about qualifying at the range? I mean, subject to hearing loss or lead poisoning. The possibility of 20, 30 years from now, scientists telling us, oh, well, you subjected yourself to radiation through your cell phones or through the police radios that sit on our shoulder. And then what we're dealing with today, the influenza strains that we've already dealt with during the history of our profession. Swine flu, bird flu. Many of you don't remember the Hong Kong flu or other types of flu. You were too young to remember that. But what about viruses? You do remember these if you've been in the policing profession for a decade. SARS, Ebola, Zika, and how about bacteria like MRSA and anthrax? You go into the hospital to get well and you contract some type of bacteria in what's supposed to be a healthy setting. So what are we dealing with today? What are you dealing with today on the front lines? You're dealing really with two major challenges here. One is at home, your personal and family challenges. And the other is your professional challenges. And this list is by no means a complete list, but these are some of the topics that have come up on blogs and websites and emails and what agencies and you as individuals are dealing with. And that is your personal health. What is your long-term, what's your long-term personal health going to be when you're interacting with people who may be carriers, may already have been tested and have tested positive for the virus, but don't tell anybody. And we all know that during the course of our career that we're not as healthy as we gain years as we were when we first started this career. Officers develop different health-related challenges, and it makes us more susceptible. It weakens our immune system. And we'll talk about how stress and other challenges in our career weaken our immune system too. How about our family health? Obviously, that's at the forefront. Police officers responding to the hurricanes in New Orleans. We're thinking, well, how is my family supposed to deal with the challenges of the hurricane while I'm off helping other people? And how about social distancing from your loved ones? Many officers aren't living at home during this particular period of time. My wife is a nurse practitioner who works at the VA. The Indianapolis VA is one of the highest, is at the top of the list of VA hospitals that has COVID-19 infected patients. So her unit was converted into a COVID overflow unit. So, we're very careful when she comes on, but we did discuss the idea of me not living at home during that period of time. And that puts a strain on the family. Your children are at home right now. The schools are shut down. Your families are home and you want to be part of the family. If you've been to any of my training, I always advocate your investment in your family. So this is a huge issue. And because we are emergency workers, we are not going to be fairly adjudicated when it comes to looking at family medical leave because of the work that we do and the situation that we are emergency workers. What do you do about groceries and supplies? And everybody's on this great toilet paper run. There, if you remember the trying to get Beanie Babies back 15, 20 years ago, trying to get toilet paper is like trying to get a rare coin. Financial impact. Many of you, your spouses, your partners aren't working. Many of you that relied on part-time or overtime, courts are shut down. Your places of business where you earned part-time, those places are shut down. We want to take care of our families, but many of us, we've always had this duty before family mentality, and right, wrong, or indifferent, it does impact us during this particular period of time. How about the challenges professionally? How are we supposed to social distance from the public when we're responding to a run or checking on businesses? How is your agency doing when it comes to testing or screening or documentation? That's what we always worried about early in our career when we did run into somebody with TB or became HIV infected. It was months before policies came out and proper documentation was done that would protect us during the course of our career. And will insurance cover us? We talked earlier about we can't even put officers and honor them properly on memorial pages until we're absolutely sure that this is how they passed away. Well, I'm not talking about you passing away. I hope that doesn't occur, but even if you are affected, long term, will your insurance cover that? What about your safety while you're in personal protective gear? I went through all that in my career, all the testing, all the training, and we all know that it's miserable to try to do anything when you're geared up, and so that affects your your safety. And is it available? Does your agency even have that type of gear? What about an uptick in domestic disturbances? We talked about Officer Lee responding to a domestic situation. We know that initially it really didn't hit, but now it's starting to hit. States have changed their laws so that storefronts can deliver alcohol. Now, the last thing we need when people are cooped up with cabin fever is them drinking. How about staffing resource issues? Those are going to be huge. Many of you, your detectives, your administrative personnel have been told to work from home, and it affects the ability of your agency to get a number of people out if you ever have a call out or a situation where you need more people responding. How about policy changes? Has your assignment been changed? I mentioned my wife, her unit was shut down and she was moved to a overflow COVID unit. I mean, things change and it does affect you. And it's easy to say that we're tough, we're team players, but we all know that we like our routine and it does affect us. Lack of information is huge. We're not great communicators even in the best of times. So there are other things that we can do to quash rumors and to communicate better. So we'll get to all these things during the course of this presentation. So this is going to be quick. We're to get through this because I don't want you to log in and think, oh, I'm going to spend half an hour with this guy. So we're going to talk about the root of crisis. We're going to talk about things that were already brewing in your life or at work before coronavirus hit and why that's important, and then what we can do, what resources are available. So, we take this journey during the course of our career, and we know that we brought baggage to the job when we were hired, and then we accumulate things during the course of our career. If you've been to any of my classes, these are things that I teach that, your applicants bring to the Recruit Academy, the things that affect us all in our lives. And on the surface, they may not be a problem, but if they're not dealt with or they're simmering below the surface, these are things that we just pile new experiences on top of. And what happens over time is, we sink to the bottom based on the weight of that. Or another analogy I use is a wheelbarrow example, where we already arrive at our Recruit Academies with a wheelbarrow that has some stuff in it. And then we're constantly doing what? We're adding those experiences to that. What are we adding to it now? Over the last month, we're adding our COVID-19 experience to that. The stresses of dealing with that uncommon experiences. So your wheelbarrow is getting kind of full. Now, the optimal way to be is to not have a full wheelbarrow to start, so that if you're adding things to it, it's not adding enough weight where you're just not going to be able to go anywhere. So we're going to talk about what you can do to reduce some of the crap in your wheelbarrow, because crisis and stress are very real parts of our career. Again, if you've been to my training, I talk about the 5 reasons that officers fail. These are very major categories that affect most of us in our career. I'm going to show you some numbers here in a little bit, but addictive issues, mental health, emotional health related issues, general health issues, personality behavior issues like anger, control, that victim thinking. We go through our career feeling like victims of things, and then family relationship issues. And the family relationship issues aren't last because they're least important. They're last because that's the foundational piece. We'll get back to that here in a second. But here were the numbers when we first did our first survey in Indianapolis with our agency after training in 2013. Again, subsequent trainings, government grant to follow up the training in 2018, and the needle didn't move much. We had these very real issues, these things in our wheelbarrow as we go through our career. And look at the last one. I talked about the foundational piece. 1/4 of the officers in your agency and my agency are dealing with an ongoing toxic situation at home. So it's hard to depend on that family support system. And that is huge. The number one reason that your officers are going to church counseling or EAP counseling or seeking out professional help is for marital and relation issues. Now, this is good because we're not going to get to this today, but in training that I do, we'll talk about that being the number one issue of why officers are in distress and why officers consider self-harm. And it's officers in the middle of their career, middle age, with relationship issues. And so this is a huge issue. So on the one hand, this is good that they're seeking help, but on the other hand, it does present an issue that we have a lot of stuff in our wheelbarrow. So if you don't want to use the wheelbarrow analogy, use the cup analogy or the glass analogy. Now, how full is your cup? How full, is your cup today? How full was it a month ago when this first hit? Because if your cup is almost, spilling over, then you've got to do something about it because you're not going to be able to add anything new like what we're experiencing right now. And you're a ticking time bomb. And unfortunately, we're going to be asking you to do more and more and more and more. But we're people. We tend to compartmentalize things. We tend to internalize things, and things bother us. Things that we have no control of. Ferguson. If you were an active police officer during that time, that bothered all of us. But there's nothing you could do other than offer moral support unless you're willing to drive to East St. Louis and help out St. Louis PD. There wasn't a whole lot you could do other than stand with our brothers and sisters in what was going on. So you can't allow yourself to be stressed out or respond in a stressful manner. Finances, you don't think of finances as being stressful, but look at these facts and figures provided by My Money Wellness. We're living paycheck to paycheck. We're bringing that stress to work. So again, these are things that are already in your cup, in your wheelbarrow long before the crisis of a 9/11 or a coronavirus hits. And how does it manifest itself? It manifests itself by creating problems for you. This list is consistent with the list that I just provided you of the 5 reasons we fail. Self-medicating, medical related issues, sleep disorders, weight gain, acid reflux, migraine headaches, irritability, anger, and then again, it challenges, your family situation. And the thing that you need to keep in mind is that stress isn't circumstance. This coronavirus period is not stressful. You create the stress and you put that on yourself. So in understanding that, look, they're going to be challenging situations, but your stress level depends on how you respond to those challenging situations. If you have ways to inoculate, ways of being healthy, then you're not going to respond in that manner which, spills over in your glass or makes your wheelbarrow so heavy. So let's talk about some of those. This is you as you go through your career. There are 2 main axes I want you to think about. Your ability to cope or control, which when you start your career, even with some stuff in your wheelbarrow, is pretty strong. And your level of pain or crisis, even though you've experienced things in your life, is low. But over time, our coping meter diminishes and our pain increases until we are in the yellow zone, the orange zone, the red zone, and then we're in crisis. What we should be doing is making sure those lines don't cross. Look, you're going to experience things, challenges. You're not going to always have the ability to cope, but there are ways to strengthen that and to reduce the pain so those lines never cross. And this is the key. This is the key to keeping that wheelbarrow or that glass, empty rather than full. And if we're going to practice resiliency, you've got to do it both at home and at work because it's difficult. One will spill into the other. We talked earlier about stress over finances, and bringing that to work. Officers admitting through survey that, yeah, I bring my financial crisis, at home to work. So the way to do that is to increase that ability to cope. Now, ability to cope is going to change on a daily basis. It's like the stock market, it's all over the board. But there are things you can do to help yourself cope. I've worked with over 300 officers post-shooting during the time that we ran the Wellness and Development Program, Development and Wellness Program in Indianapolis. And it was almost universal that officers who went into that critical incident or challenge with a high coping meter in pretty good shape, not dealing with bankruptcy, divorce, relationship issues, sick kids, financial issues. They were the ones that came out the other side in pretty good shape. So there is something to be said for, going in and preparing yourself with the ability to cope and respond positively to a challenge. Now, look, certainly you can experience situations that are traumatic that just rock your world. I've had them happen in my career. What I'm saying is from the standpoint of recovery, from being able to make yourself immune to what you're going to experience during the course of your career, you're better off by practicing healthy practices. What do we mean? Stress inoculation. There are things that you can do. Things that as cops, we laugh at them. Yoga, I'm not going to do yoga. Although we have many more police academies now teaching yoga to recruits than we had even 2 years ago. Teaching yoga to veteran officers. These classes are jam-packed, believe it or not, once you offer them and people realize the value. How about meditation, mindfulness, centering things in your head, taking a moment each day to just reflect upon who you are and what you're grateful for. And during this period of time, I would recommend that you get on a podcast or get an app on your phone. And we'll talk about what resources are available and do that. Get up in the morning and do something. Just spend time with you, focusing on you, and focus on positives in your life. And trust me, it will help you immensely to get through the day when you're being bombarded with negative experiences. Healthy habits. This is the time where you need to be eating right, exercise. And I know that's challenging. Gyms are closed down. Social distancing is, but the weather's turning in most of the country. You can get outdoors. You can keep your distance. This is the time where you need to improve your immune system. Quality choices. This is not the time to be making dumb choices. Life is a marathon, not a sprint. The stupid things you do today will reverberate throughout your life. So just don't do them. Count to 10, ask yourself, put something off 24 hours, use a 24-hour rule, but don't make dumb choices right now. Don't ever, but now especially. And then controlling things you can control. Like I said, don't get stressed out about things that are beyond your control. You're not going to control the president, your chief, Congress, the Fed, this virus. So just do what you can do in your own little world, you and your family, to control what you can control. Control the good things. Control your investment in your health, your investment in your family. And don't think, I'll do that. Yeah, that's a great idea, Cap. I appreciate you saying that. Look, it has to be a long-term commitment. You're not just going to do something one day. Think of all the people that buy treadmills for Christmas, and then by Valentine's Day, they're hanging their clothes on them. So again, you've got to change the neural pathways in your brain from a small fisherman's path to a 5-lane superhighway. You're not going to do that doing something one time. This is how you survive. This is how you win. It starts with building that foundation, the support system, learning how to cope, practicing healthy habits, practicing, control what you can control, and don't worry, don't stress what you can't control. That's how you survive. So I told you that we would look at ways that you could do this in this particular environment. Focus on stress reduction, your response. Again, stress isn't circumstance. Stress is how you respond. And again, by practicing an alternate response, again, for 66 days, you will find that works. Think about something that just bugs the crap out of you every day. It's probably something small, because we handle the big stuff, don't we? It's probably something that makes you angry. Practice an alternate response. And over time, you will find that you don't get angry because you're substituting a response. It really does work. But you're going to have to do it long term. Control what you can control. We've talked about that. Maintain your investment in your family, even if separated. Zoom, Skype, whatever you need to do. Go by the house, talk through the front door, read to your kids at night. Do something to make sure that you're keeping that fabric sewn. Practice relaxation techniques. We talked about that. I started meditating when I retired. And you're thinking, well, yeah, you're telling us to do it now. Yes, I am, because I wish I would have done it during my active career. I can absolutely tell the difference. I don't meditate every day, but I meditate any day that I travel or I'm doing any type of work, and it makes a huge difference in the world. You're more laid back. Uh, Things don't bother you the way they did. And when I first started, it took me about half an hour to really center myself and get to the point where it really relaxed me. And now I can do it in about 2 minutes. So again, practice. You have to practice something or it's not going to come to you. Please exercise safely. Again, don't go to the gym. Find an environment where you can exercise and make sure you're in physical shape enough where you can do that too. Professional clinical resources, don't forget they're still out there. Yes, they may not have office hours, but I've called around the country. Most of your chaplains programs, they're still taking phone calls. You can still meet with many of them. Just keep your distance. Your EAP programs, they're doing teleconferencing. There's still ways for you to talk to people that give you good advice. Your peer support teams, again, fellow law enforcement officers who can be very helpful to you during this particular period of time. Professionally, these are aimed at agencies. If you're a supervisor, somebody who has influence in your agency, an executive, communication is the key. Please give your people daily briefings. Quash those rumors. And remember, you have shifts working around the clock. So videotaping them and showing them and subsequent roll calls or briefings, great, fantastic. Do you have testing, screening checkpoints? Do you have decontamination points? These are really what officers want. They want to understand why this is being done and why we're not doing it if you're not doing it. Encourage your people that are sick to stay home. I didn't mark off a single day of work through the first 20 years of my career. So proud of that. And now I look back on how stupid that was. Box of tissues in my car. I think, oh, I'm in my patrol car. Who am I going to affect? You know, I go through a box of tissues on a shift thinking, oh, saved another sick day. That's just stupid. And I can say it now because I was stupid. Please don't do that. If you're sick, especially in this environment, stay home. And then even after this is over, learn to just stay home. And if you're a supervisor and you think somebody's trying to pull the wool over your eyes, at this point, who cares? Look, we were shorthanded on January 30th of 1984 when I got hired, and we were shorthanded on January 29th of 2017 when I retired, and every day in between. So you're always going to be shorthanded. If your person needs a day off, don't make them come in if they're sick. What about availability and testing of your personal protective equipment? This is huge. Some agencies don't have it. So if you have it, you're blessed, but you need to be testing and it needs to be available. Childcare options. A lot of agencies now are looking at ways that they can help out their officers with childcare while their kids are home, especially single parents or if both spouses work. This is huge if your agency is doing it. If not, please ask your agency if there's not something that they can do. What about quarantine facilities for employees? Check with Marriott, Hilton Hotels, IHD. Many of these hotel chains are offering rooms for free or at a at a very discounted rate for first responders, police officers, firefighters, nurses, doctors, emergency response people. So please check into that. What about dispatch screening, warning your officers if there's information, flagging those particular addresses. If that's not being done, it needs to be done. And then plan for the unexpected. We don't know what the result of this is. You've got people out of work. You've got people losing their jobs. You've got people that can't afford to pay bills. You've got people cooped up together, and we're already seeing the effects of that. Please, please, please have a plan for how to get your people that are home in, geared up, masked up, and how to help your people who are currently at work. And again, this isn't a complete list. This is just a list of things that I've been aware of, that I'm cognizant of, that are important issues to officers. And at the end of the day, you need to get everybody on board. Everybody who needs to be on the bus needs to be on the bus. Now, what resources do we have? Your family is number one. If you're separated from them, again, figure out a way that you can communicate and keep in touch with them. Peer support, wonderful. Again, it may be done differently in this environment, but it can still be done. Same as clinical EAP, professional medical resources, medications. If you're on medications, anxiety, depression, blood pressure, anything, pay attention to how many you have left. Don't let them run out. Again, this doesn't apply to you, it applies to your family too. Get your medications now while they're available. I'm not saying they won't be available. We don't know how these, the supply chain has been disrupted with, items other than those items that people seem to be going crazy over. But again, medications are huge. Always have a supply on hand. Family programs. There are still family programs online. Many of your kids are having online classes through schools. The same thing applies if you're having trouble at home. Utilize your EAP or other types of family programs through your church. Chaplaincy programs, again, the rules may have changed on how they're operating, but they're still available. Some national 1-800 or toll-free hotlines for trauma or for addiction or mental health issues. Please snap a picture of these resource lines. And again, the National Police Suicide Hotline, please take a picture of this if you don't already know it. Some alternate proactive resources. Again, we talked about mindfulness, meditation, and yoga. Again, another slide you should be taking a picture of. How about phone apps? Use your phone for something other than texting and reading Google. There are all kinds of great sleep apps, exercise apps, meditation apps. Great apps that will count down while you're meditating. So again, look at what's on your phone. How about podcasts? If you've never used the podcast app on your phone, this is a wonderful time sitting in your car while you're exercising. But a warning, don't overwhelm yourself with, I say the same thing to officers after they've been involved in a shooting or critical incident. Don't be Googling your name or the incident. Don't go overboard just because you're not going to like what you hear. It's just going to be something that will create more of a stress response. So get on once a day, read the update, and then let it go. Don't be just watching the 24-hour news. It's not healthy for you. Read now. This is a wonderful time to be learning about how to invest your money or what you can do with your money. And then what you can do also with diet and exercise. Podcasts are wonderful. That's really about it. We didn't want to belabor this issue. We wanted to have you something you could watch in your patrol car. You could show it roll call. You're more than welcome to show this or share it by email or some type of electronic means. If you have any feedback, if you liked it, have anything you'd like to add, any questions, please you can contact me at bn@healthyhire.healthyretire.com, or you can contact the Dolan Consulting Group. And I'm honored to be here today addressing you. I'm honored to have been part of the profession. And please, you and your families, be safe, and thank you for what you do. Thank you.